Hello, folks. This is your host, Dr. Graham Taylor. Before we begin today's episode, we have a special announcement. Please come join us for the 2024 Triad Summit Series. Mark your calendars for May 17th from 9 a.m. to 11:30 a.m. Pacific Time. This event is online and is completely free to attend. At this one-day summit, you'll have the opportunity to learn from two esteemed experts as they share valuable strategies for addressing the mental health crises that we are in, aiding in trauma recovery, stress management, and helping individuals reach their highest potential. Don't miss this chance to connect with innovators in mental health, gaining insights from industry leaders, and fostering connections within the wider wellness community. Learn more and reserve your spot today at triadhq.com/TSS. That's triadhq.com/TSS. I hope to see you at the summit.
Welcome to Behavioral Health Today, a podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective.
Welcome to Behavioral Health Today. I'm your host, Dr. Graham Taylor. And today I am joined by a return guest, Dr. Lloyd Sederer. Lloyd is an adjunct professor at Columbia University School of Public Health and a distinguished figure in mental health leadership, with 12 years as the Chief Medical Officer of the New York State Office of Mental Health. He's also served as NYC's Mental Health Commissioner and Director of Clinical Services for the American Psychiatric Association. Lloyd has also led significant mental health projects, including disasters in response to 9/11 and the Hurricane Sandy. Lloyd has an extensive publication record with books, articles, and media contributions. And in 2019, he founded Columbia Psychiatry Media, producing excerpt content for Medscape and other platforms. Currently serving as the Chief Medical Officer for Bongo Media, Lloyd continues to hold leadership roles in several impactful organizations, contributing to mental health, addiction, and social justice initiatives. I'm really excited to have Lloyd with us today to discuss America's healthcare system and his new book, Caught in the Crosshairs of American Healthcare. Lloyd, welcome back to our show.
It's so great to be back. I love so much talking with you, Graham.
It is so nice. You know, you're one of my favorite people, honestly, and one of our show's most loved guests. And I'm so happy to have you back with us today. Your new book, Caught in the Crosshairs of American Healthcare, tells the story of the corporatization of American medicine and its costly and its negative consequences to us all as patients and families. And I'm looking forward to our show today to learn more about what your research has shown and also what you're writing in your book about the nation's healthcare system at this time. And I'd like to suggest, if we could, Lloyd, maybe a little bit different format that we're usually used to in our previous shows. You know, your book, it reads a bit like a novel, and you've even got some humor woven into it. And given this, I'd love for our readers to get a sense of its content by listening to some excerpts from it. And then maybe you and I can kind of ping back and forth and explore these in some depth together. Would that be okay with you?
Yes, I would appreciate that. Many people think it's a dry, technical book, even by the title, but many have said to me, no, you have to indicate to people, like you just did, that it's more like a novel, story.
Maybe we could demonstrate and illustrate some of that in our time today. Let me start with this one here. In the 20th century, McLean was where the VIPs went. The hospital sat on 246 acres of bucolic land designed by the famed Frederick Law Olmsted of Central Park in the U.S. Capitol. There were 46 buildings, a walking path through a lovely forested area, and a large collection of decorative trees. It was a bit like a country club for the elite mental patients, typically white and typically rich. Treating celebrities and wealthy patients, McLean had the aura of a special place where special people like poets, writers, entertainers, and the Zions of industry and banking went for psychiatric care. But McLean became a very desirable target for the fast-growing corporate control over U.S. healthcare. It represented traditional medicine where the patient comes first, with Harvard faculty doctors making decisions, not corporate MBAs or CEOs. Taking it on and taking it down by business for-profit companies could be seen as shooting a prized elephant in the herd. The hospital's unwillingness to bend to the financial and clinical demands for-profit health insurance companies and their tentacles, managed care organizations, made McLean a place even more of a trophy worth winning. So let me pause this right here. And this is an interesting excerpt, and it's an example of a system's unwillingness to bend. Walk us through your thoughts on this.
My thoughts are that what is happening to U.S. healthcare now, the corporate ownership of most everything in healthcare now, is the most destructive trend that has happened to American medicine in God knows how long.
Yeah. I was listening to Kennedy, who's running for president, and he was talking about how the large organizations have taken over everything here. And it has really taken away the care that people receive in needed ways. And McLean was trying to preserve something, weren't they?
Yes, we were in their crosshairs. That's what the book suggests. And we were because we were an iconic hospital, a Harvard hospital, Harvard teaching hospital. And we didn't want to do what they wanted, which was essentially make the decisions themselves about through, programs or artificial intelligence about what should be,
Right.
what shouldn't be approved, and pay maybe 50 or 60% of our operating costs.
Wow. Wow. What was some of the wrestling like for that? How did that go in the back and forth as they maybe tried to come in and put McLean in the crosshairs?
Well, we had to buckle down for a very long battle to stay afloat. What happened very rapidly was these companies cut us off from referrals because hospital referrals require prior approval, which is what they have. That's the control that they have. And so we weren't in their network, and our referrals, which were private insurance in good part, began to decline very rapidly, and we began to hemorrhage money, millions of dollars.
Isn't that amazing? So right out of the bat, you're talking about one of the best hospital systems and places to go for care. They began to kind of choke you guys. They began to kind of squeeze by not allowing the referrals to come in because of the insurance. That's amazing. So now we're getting a pretty clear example that this wasn't about patient care. This was about money.
Yes.
Yeah.
We were about patient care,
Yes.
but that is the nature of for-profit companies, is that their first mission, foremost, is to make money for their investors, for their equity investors, their shareholders. And we, as patients, families, we come second. And if we put in peril that profit, they're going to try to knock us down. They're going to try to run us over.
Amazing. I want to get into in just a little bit, some of the consequences of the dominance of the for-profit healthcare. You're giving us a little bit of a foresight right here, right now, and what happens to patient care in the process. I read that first excerpt. Would you maybe select another excerpt that for you has some meaning, and maybe we could begin to kind of frame this as we talk? Give us another excerpt, would you?
Thank you. We just actually covered a short excerpt that I called Managed Care.
Okay.
True, but I want to move on to another, which is change.
Okay.
There are many books about change, but none quite depict the human and social price of radical change. But there is one world-class agent who captures what that is like and what was our experience as a leadership group at McLean. And that change agent was Mahatma Gandhi. As we know, Gandhi helped lead a huge nation to freedom and democracy. One comment he made when asked what was it like reveals the bruising, ironic, and sweeping experience of how culture, countries, and complex organizations are transformed. And he said, first they ignore you, then they shame you, then they fight you, then you win.
I really like that. So here's somebody who is probably, like you said, the world-class agent of change, the change agent, Mahatma Gandhi, and his story is phenomenal. But there's a sequence of getting to a place of winning. You get ignored at first, and then you get shamed, and then they're going to go after you. But if you can hang in there, and then you're going to have a chance to win in the end. Walk me through how that was part of the case with McLean and what you were going through, the ignoring, the shaming, then the fighting. Walk us through that experience.
You want to give me bad dreams tonight, but
I bet. I'll bet.
well, what happened at first was that we were ignored. Well, our team, my boss and I in particular, we were saying, we're going to go down. We've got to make some radical change here. And the culture of the hospital at that time was run by a large private group of psychiatrists and psychologists who were the doctors for the patients. They were the therapists, actually, and their model of care was long-term inpatient psychoanalytic psychotherapy, which I knew is not a first choice for people with serious mental illness, psychosis, schizophrenia, serious trauma.
Yeah.
And it didn't take that long. So, before we started to hemorrhage money, it was like 9 months or 10 months. But during that, nobody paid attention. Nobody cared. Hardly anybody cared in that group. And that group was large. It was about 80 or 90 doctors. And they were the respected members. They were the seasoned members of McLean. And McLean prospered for decades in that culture and using these doctors over time. Then we started to hemorrhage money. Then we were no longer ignored because they could no longer ignore the reality. Referrals of patient beds dropped by a half over time. They could not deny that. They could not ignore that. So then moved to the shame part. Examples of the shame were that we were crazy, that we were going to ruin McLean Hospital, that we were going to erase its stature as an internationally recognized psychiatric hospital. And they went on and became more ad hominem personal. So the one directed at me was that I was doing this. I was, principally responsible for the clinical change. And I was doing this because I was paid so much money. Now, some people will know that academic medical centers do not pay their doctors a lot of money.
No, they
but
don't.
that was a way of attacking me.
Yeah.
And other ways that suggested that I was doing this personally, that I didn't really appreciate what patients needed. That was very hard to take, not just by me, by our leadership team, very hard. And when somebody shames you, my experiences, or at least for me, I want to fight back.
Yes.
And I want to fight back, hard. And I didn't, because that just embroils you more, the shame.
Yeah.
So we had to keep our mouths shut. And I discovered then and many times that the only way out of shame is pride. And it's pride in succeeding, and it's pride in demonstrating with good data, information, patient feedback, that we were doing what was right for the patient and they were getting better. And I set up a system of that kind of management, which was pretty rigorous. We won awards, we licensed, so we could begin to show the process.
But I want to hold you on that. I love the idea of coming back and with being data driven, being able to show results and letting the results speak for themselves. But the shaming wasn't so much of, this hospital doesn't do it the right way. That shaming became very personal,
Yes.
both a personal, kind of a character assassination almost, both personally and professionally. That's the darker side of manipulation and kind of almost kind of psyops in a way where they're beginning to characterize you professionally, personally, going after money, etc. It's hard not to want to react to that, isn't it?
Yes. And one of the chapters in the book is titled The Best of Intentions or something like that.
Yeah.
And I believed that these were doctors who thought they were defending a place and a process that needed defending, that they were not bad people. They were
Yeah.
people who were following their own convictions at that time, but
Yeah.
their convictions were wrong. They weren't bad people. They were just people who who were dated and no longer knew what was needed. And that was important because their shaming didn't come, personally. It came from, how are they going to stop this from happening? And
Exactly.
one way to do that is to attack the people who are making it happen.
There's a good lesson in what you just shared right there. The way out of shame is really kind of centering yourself within yourself, in this case, within a system that says, hey, are we doing right things? And to anchor ourselves in, the work ethic, the mission you had, and then watching, it sounds like through your work, the data kind of speak for itself, kind of anchoring yourself in a healthy pride in who
One
you
of
really
the best
are.
points for me during that process, therapeutically, was bringing that data to the board
Yeah.
every few months, because these were docs who knew the board members, treated members of their family. They had a lot of influence, and the board was the board, and they were mostly major donors, very people of influence. So I was coming to the board in a different way. I was coming to the board to say, hey, take a look at this. This is what is happening. Even though we're losing money, it's necessary to start with the clinical care to change the culture. And we were headed in the right direction.
We'll be right back after word from our sponsor.
Whether you're a longtime or first-time listener to Behavioral Health Today, you're probably familiar with Triad, the company that brings you this podcast. But you may not know that Triad also hosts a community for current and aspiring behavioral and mental health professionals, featuring trending content and education and career resources, all for free. If you are a behavioral or mental health professional, or you're studying to become one, join more than 80,000 people on Triad by claiming your free professional account today. Visit us at hellotriad.com/BHT. That's hellotriad.com/BHT and join the Triad community today.
It's really good. You gave us kind of a topical heading for this last excerpt is around change in the process and what you go through with being ignored, shamed, and they fight, and then there's a winning. Let's segue a little bit into maybe another excerpt and maybe kind of give us a kind of a thematic focus of this next excerpt.
This one is called Girl Interrupted. You might not have heard about Susanna Kaysen's slender 1993 book, Girl Interrupted, a fictional depiction of her being hospitalized at age 18 at McLean, where she remained for a year and a half. But I imagine that some of you have seen or heard of its 1999 film production with the same title, Girl Interrupted. Angela Jolie won an Oscar for Best Supporting Actress. Other cast included Winona Ryder, Whoopi Goldberg, Vanessa Redgrave. Kaysen, in her book and then further through the film, told a chilling tale of psychiatric hospital oppression and the endless, bitter battles between patients and staff. Her characters embodied the painful and often hopelessly depicted varieties of mental illnesses, as well as their bleak treatments. That was the culture we were taking on at McLean. So I had the bright idea to invite Ms. Kaysen to come to McLean to be interviewed in a public setting, and all the staff were invited, and we had to clear out the cafeteria. I mean, it was standing room only, but she came, she agreed. And she was very frank and articulate about how psychiatric care can go wrong and how that happened with her. But she also, before finishing, she gave us a window into how a person with mental illness rebuilds their life, reflecting and making sense of the sometimes strange workings of our mind by developing and maintaining supportive relationships, by finding purpose, and by staying the demanding course of recovery as it is for all chronic conditions.
Well, that's powerful. Yeah.
By the way,
This
I interviewed her by intention, and I wanted her to be interviewed by a woman doctor and someone who had considerable stature, not just in the hospital, but in the psychiatric and research community.
So when you're interviewing her and hearing her in kind of a standing room only presentation, what were some of the takeaways that were impactful around her story that might have been implemented in some really positive ways?
Well, my colleague, she's really very accomplished. She asked the important question: who were the most important staff at the hospital, and why was that? And her answer was immediate: nurses and aides, because they are the people that you daily encounter. They're the ones that are on the journey with you, and many of them are very kindly, and they're very believing in your capacity to get better. And that was the message. I couldn't have scripted it better, that I wanted the large group of staff, clinical staff, to hear from someone, not from me.
Really good. I think it takes us back to something basic but so profound. The idea in a situation like this with mental illness is someone has to determine what their purpose is going to be and move towards a recovery journey that's based in hope. But it brings us back to the very, very simple reminder that it's always done best within the context of relationships. We're not necessarily always leading somebody, though sometimes we might be, or we're not always pushing somebody, although gently we might be nudging somebody, but more times than not, it's right alongside them.
Yes.
And just being a part of that journey. Say more about what maybe some of the takeaway conversations were after this talk with her, and what conversations you guys had professionally, and maybe even some changes that might have been made, or at least roles emphasized.
I don't know. We didn't have a way of measuring, but I think it was a moment that touched a lot of people and further supported what we were wanting to do, what was underway, because this took 5 years, Graham, and hemorrhaging millions of dollars every year. So the staff thought, well, many of us thought that the hospital is going to close, it's going to be sold out. And they were really concerned that we, could be doing damage to their job. Some of them, particularly the non-professional staff, had worked there for generations. Their families had been part of the hospital for generations. So it was really important to touch their hearts, to, as you say, to use a relationship to help continue a change that was underway.
What distracts me as you're talking right there, you're thinking that corporate healthcare would rather crush and kill something good.
Yes.
Rather than, if nothing else, just leave it alone.
Yeah, that's unfortunately the case. And we all, as patients and families, suffer the consequence, because it's very detrimental. And all of us know now the experience of how hard it is to get an appointment with a doctor.
Yeah.
When you finally do, you go to the doctor's office and your visit is 10 to 12 minutes.
Right.
And your doctor is not looking at you. Your doctor is sitting and typing into the monster of electronic medical records. So with that goes the doctor-patient relationship, which is so fundamental to good care in many ways. The United States now, when compared to half a dozen other large international countries on measures of quality, is at the bottom of the list. And these are measures like how long do people live? Is the rate of a chronic preventable illness, like, not preventable, or at least treatable, diabetes, hypertension, heart disease, asthma, infant and maternal mortality rates. And you believe the United States has the highest rates of death for infants and mothers, even when compared to third world countries. These are some examples of what is happening. And one of the other consequences that I have tried to report on is that doctors, other health professionals, nurses, they're fleeing medical care. And there was a survey just recently asking hospital CEOs what they thought their major problem was, what was keeping them up at night. And they all uniformly said workforce problems. We don't have enough doctors. We don't have enough nurses. And that's why there are delays. And in fact, that's the case. They're now signing bonuses being offered. This exodus started with COVID, but it didn't stop. And now when the doctors are asked, why are they leaving? They say for two principal reasons: burnout and what's called moral injury. Now, importantly, this as a clinician is not the same thing as depression. It may look like depression, but burnout is a result of working in an environment that is unbearable, that is toxic to you and keeps you up at night and keeps you stressed and has you spending hours at night with the electronic medical record and so forth. That's burnout, and that's one of the two. The second is what's called moral injury, which is a fancy way of saying that you know that you are not living up to your own standards.
That's right.
And that's a very unbearable state to be in as a professional dedicated to people and their care. Yet many stay because they're loyal to their patients, they're loyal to their colleagues. Maybe they just need a job. And those are the ones who suffer from moral injury, and coupled with burnout, they can't tolerate. And the exodus continues, the workforce continues to diminish.
I've really seen that firsthand. A colleague and I were contacted at the beginning of COVID by a doc here in Hawaii where I live. And she was saying that, hey, we need to have a group for doctors who are going through all the demands related to COVID coming into place. And they tried to approach the hospital, and the hospital said, you will not talk about the decisions and basically the moral injurious crossroad decision times that they were having to go through. The hospital disallowed the discussion amongst even the staff to do that. And so they reached out to us privately and to be able to see us outside the hospital system. And we've met with them since COVID currently. And some of the things that they shared with us, all confidentially in terms of patient identification, but the moral injuries they had to go through, the hours, the demands, the limits, the mandates, and their biggest struggle, like you said, they were providing really good health care in terms of the quality of care they provided. But some of the decisions were made by those not in the room with the patient, not in the situations. And it's really what you're saying right now. And what a sad statistic. You're saying that through comparison with other countries, large Western type countries, Germany, Japan, I know your book goes into that. You would think like a country like the United States would have better stats around longevity, preventable illnesses, maternal and infant mortality, like you said. even things like obesity and or maybe even the number of chronic illnesses, let alone per capita suicide.
Yeah,
Something is not working and we're bleeding out.
and drug addiction, overdoses,
Absolutely.
fundamentally wrong going on here. And the solution, nobody stepped up, has been able to step up to these complex, massive problems. But one party, if you will, did step up by making medicine a business.
Yeah.
And
Yeah.
that's the road that we're on.
Yeah, absolutely. Lord, I'd love to hear another excerpt. Got
Well,
one for us?
Yes, let me read one that winds up at my door or with me. And the context was that my boss, who had hired me, decided to leave. We had surfaced, we were no longer losing money, we were clearly improving. He decided to leave and take a job in Washington. So succession, not related to the TV program, at least for me, became the order of the day. The McLean board went about its process of selecting McLean's next psychiatrist leader. I was regarded by many, including the Boston Globe, as the front runner, but for many weeks during that time, I had no phone call from our board about their decision. That's also not a pleasant state to be in, I can assure you. Then a board member called me with the news. I had not been selected.
Mm.
So my heart fell and I was surely disappointed, and I had to ask myself, where did I fail?
Huh.
And that board member was really a very generous, kind person. He said, well, let's have lunch. And we went to an understated membership club in Boston. It had the type of worn Persian carpets that cover the floors of many New England clubs and some homes. We talked about diverse careers, including his own, and I inferred from his most kindly of stories that I needed to swallow my pride, try not to choke on it, and then move on. I was no longer necessary.
That's pretty powerful.
Oh, I like to top that off, if I may, by pointing out, and not that it's comparable, but there are always wounds of battle from this type of a contest, any type of contest, and mostly borne by those who are at the tip of the spear. But recall that Winston Churchill, having led the British from their darkest hour to victory, was voted out of the prime ministry once the war was won and the peace treaties signed.
Yeah, that's quite a comparison. Actually, it's somewhat noteworthy. You know, you're voicing something that I think is common to all of us. When that selection didn't go in your favor, you're saying your first question was, what did I do wrong, or what didn't I do enough of? We tend to personalize those moments, don't we? More times than not, inappropriately, but that's where we go first. But to sit with a sense that maybe I'm no longer necessary or vital in some way, that's particularly what you walked them through, like Churchill. It's a very good analogy. And that's not an easy thing to kind of hold, is it, sometimes?
It was not, but I was done for, and slowly the handwriting was on the wall. I tried to alter my position. I tried to create a quality institute because we had all the goods for that, and everything was shut down, or mostly it wasn't even shut down. It was just neglected. That I had no purchase on staying there, and that became utterly clear, and that led to my asking for a meeting. Someone on the board and the hospital president at that time, and agreeing to the terms of my leaving.
Just in terms of your own personal study and your own kind of psychology around this, how did you work kind of mourning and grieving that? How did you work to a place of being able to accept that and then to be able to make that transition, maybe in the healthiest possible way, and and in the process, ideally, anchoring yourself and all that you did do in the healthiest of pride?
That took a long time. And in fact, among my first and most powerful reactions were in my body.
Mm-hmm.
I started to develop pretty significant GI problems. GI problems. So I had to start and, I had to have like a next colonoscopy and all this kind of stuff. And there was no way that, any medication or medical treatment was going to rid me of that somatic problems. And realized, like a good psychiatrist I'm supposed to be, that I needed to be in therapy.
Yeah.
I had been in psychoanalysis for 6 years, 4 times a week, but that was some time ago. And my former analyst had died, and I found another analyst whom I respected a lot, and I went into therapy, and that helped.
I think that's an example of being able to bring someone alongside us at times, where sometimes, the old saying that the eye can't see itself, but to have somebody else who gets to sit with us and alongside us and hold us in that journey, maybe help us to see some things that may be in that loss or maybe in that trauma, the process in it, where it's been shamed and we have to accept something that we don't want to accept, nor do we think we should be accepting it given the history we have with it, but we're forced to do something that we don't. And ideally, we're not alone in that acceptance process. And ideally, we find a way to transcend that, that loss ultimately and reclaim maybe a stronger sense of ourselves. But yeah, I can't imagine that was an easy process.
Folks, pardon the interruption, but we'll continue the discussion on our next show. This is your producer, Peter, and I want to thank our guest, Dr. Lloyd Sederer, for coming onto the show today. For more information about Dr. Lloyd Sederer's book, Caught in the Crosshairs of American Healthcare, you can find it on most online retailers such as Amazon, Barnes & Noble, Target, and more. For more information about Dr. Lloyd Sederer, please visit his website at askdrlloyd.com. Finally, you can connect with Lloyd on most social media platforms at Dr. Lloyd Sederer. And lastly, I want to thank our listeners for tuning in today, and we'll look forward to seeing you next time on Behavioral Health Today. We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Tribe Network, all rights reserved.